Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about ankle fractures. So we've talked about toe fractures and foot fractures, forefoot fractures. We've talked about rear foot and midfoot fractures, but the ankle fractures are more unique and sometimes a bigger problem. The big idea here is there's really three different types of fractures that are considered ankle fractures. Well, there's four. I'll talk about the fourth one in a little bit, but there's several different types. So one is a fibular fracture, the outside of the leg, a lateral malleolus fracture. And in these fractures, if it's a fibular fracture by itself, then it really just comes down to the same type of information as, say, the midfoot fractures, where you're saying, okay, is it stress fracture? Is it a complete through and through fracture that's non-displaced, or is it a displaced fracture that has motion, movement, or so forth? Stress fracture, of course, is treated the same way: rest, ice, compression, elevation. If it's a through and through fracture, then the big idea here is you got to be very, very careful at stabilizing this. A lot of times it means not walking on that foot, crutches, knee scooter, something to that extent. And may require surgery. If it's a displaced fracture, it always requires surgery because of the instability that will happen in the ankle if you don't treat it, and the long-term discomfort and disability. So remember that, think about that, because when we talk about other types of foot fractures, we're going to actually, or ankle fractures, we're going to kind of follow that same general guidelines, that same general situation. So lateral malleolus or fibular fracture outside of the ankle. You can get a medial malleolus tibial fracture inside of the ankle. And same type of issues. You get the three different types. They're going to be treated in a very similar manner. The point is, with a tibial fracture, you can have a tibial fracture that involves the ankle. That's the medial malleolus, that's the medial malleolus and the lateral malleolus, and it's the tibial fracture that's the medial malleolus and the posterior malleolus, or the rear or back portion of the tibia. So if you have one fracture, it's treated one way. If you have medial and lateral, so inside and outside of the ankle, it's another. And if you have all three, it's another. In most cases, if you have more than one of these fractures, you're going to be doing surgery of some sort to try to get this better, as long as the patient is a good candidate for that, just because that's what's required. That's what it's going to take to really help this individual get back to normal activities, get normal feelings, so forth. So the other type of fracture, so the posterior malleolus fracture is kind of what I was talking about as the fourth, because you can do that fracture independent, but it's not very common. The fourth one that I consider part of the ankle fractures is a talus fracture. So when you got the ankle, you've got the fibula and the tibia, and then you have the talus. It is the bottom part of that ankle, and a talus fracture is a big deal because of how it's going to affect the functioning of the ankle. And most of the time, a talus fracture will require some form of surgery. So if you have an ankle fracture, this is not something you want to just keep walking on. This is not something you want to just keep evaluating. Technically, a really good fracture, you want to get seen. You want to get evaluated as quick as you can, so that surgery can be done, repositioning the ankle. You can avoid further injury, further problems, or long-term problems by treating it correctly. So if you have an ankle fracture and you're not sure what to do with it, really, it's a stepwise process. You have an ankle fracture, number one, get off of it. Number two, get evaluated, get x-rays, see how bad it is. And number three, follow the treatment protocol that is necessary to get you back to normal as quick as possible. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 367, I think, 366, 367, I don't remember, but ankle fractures. This is a key piece of the puzzle. If you've got an ankle fracture, it needs to be treated. Thank you. If you'd like additional information, if you could reach out to us at utahfootdoc.com, we can give you additional information and even give you guidance. In some cases, these are not fractures that I will treat, but I will send you to someone that treats them all the time, because it is imperative that you get your ankle repaired in such a way